When treating medical patients, compliance can be a challenge. Anterior uveitis is one of those conditions that is critically important to be treated appropriately. As can be seen here, there are cells in the anterior chamber. Regardless of the cause, appropriate treatment requires corticosteroids to appropriately decrease the inflammation. It's been known for years that because of how the branded Pred Forte is produced, it optimizes penetration of prednisolone into the anterior chamber, which delivers the medication to the site of inflammation. The level of anterior chamber inflammation will typically dictate the frequency of dosing. Most clinicians would agree that it's important for the greatest level of efficacy to utilize branded Pred Forte 1%, so we'll typically write the prescription as DAW or dispense as written. In light of this, there are times when the medication will still be switched with the generic prednisolone acetate at the pharmacy. So it's important, if you're prescribing branded Pred Forte 1%, to make sure that you have the patient bring in the drops that they picked up at the pharmacy to their follow-up visits to ensure that they in fact were given the drops that were prescribed. As an alternative to Pred Forte, there's difluprednate ophthalmic emulsion, which is commercially available as Durezol. Durezol was shown to be just as effective as branded Pred Forte in a trial comparing Pred Forte dosed 8 times a day versus Durezol dosed at 4 times per day. Durezol is not available as a generic, so you avoid potential switches at the pharmacy. Additionally, the emulsion formula provides concentration consistency throughout the bottle, which means that patients are assured equal concentrations of active medication, even in the absence of shaking the bottle. But keep in mind that, just like any corticosteroid, there are side effects, including the potential promotion of posterior subcapsular cataracts, and more commonly, increases in intraocular pressure. Remember that certain conditions, specifically things like anterior uveitis, require branded products for optimal outcomes. Having patients bring in their medication to the follow-up visits is critical to making sure they were dispensed what was prescribed. Durezol may be a reasonable option because of the lack of generic formulation available, and make sure to appropriately schedule follow-up visits to monitor the success of therapy. Keeping these things in mind will help us better care for our patients and improve clinical outcomes, which is ultimately why we do what we do. We hope that this has been clinically insightful.